You're listening to localwebradio.fm. Community-minded, locally focused.
Welcome to the Healthy Smiles Oral Health Show with Dr. Norm Ickert. Brought to you by Ickert Dental Implant Center, where they are committed to providing you with the very best in modern and advanced dentistry. Now, here's your host.
Hello, this is your host, Nick Jaworski, and I am here with Dr. Norm Ickert, Director of Ickert Dental Implant Center, and today we'll be talking about oral health and wellness. Now, before Dr. Ickert joins us, just a reminder that if you have any questions or require assistance, you can call Dr. Ickert's office at 604-881-1381. That's 604-881-1381. Dr. Ickert, it is great to be talking with you today.
Well, thank you very much for having me on. It's a real privilege, and I'm really looking forward to it.
Any experience with podcasting before?
Actually, none at all. So this is a first-time event for me.
Well, I am ready to get talking about some teeth. So when we talk about oral health, which is the topic of today's show, what are we talking about?
Well, Nick, I have to say that it's something that I'm extremely passionate about. I mean, I've been doing this now for well over 30 years, and it just amazes me that every day I learn something new about the significance of oral health. It just seems like oral health is so important to our overall general health and well-being, and I think in many ways it's underrated and underappreciated, and we can learn so much from our oral health in terms of how we're really feeling with the rest of our bodies. Mm-hmm. It's good to be able to state that there has been great progress made in many ways as far as oral health is concerned, and certainly a lot of the diseases of the past have been brought under control, and especially here in the Pacific Northwest, we've been very fortunate to have excellent health care and health care awareness. And there's been a lot of efforts made by a lot of wonderful people, both in the educational, preventive, and treatment areas of our profession. But, you know, it really has struck me how much a lack of dental and oral health can greatly affect the quality of our lives. It restricts our activities, whether it's at school or at work or even socially or even at home. You know, I get the privilege of seeing patients every single day in my office, and they all come with significant concerns. And they tell me their stories, and when I listen to their stories, I realize it's just so much more than just teeth. Mm-hmm. There is such an emotional, psychological component to our oral health. And it's just something that I just feel really, really passionate about. And it's a real privilege to be able to help people feel better about themselves as they get better care for their oral health.
That was inspiring. So it sounds like oral health is more than healthy teeth. In addition to sort of the larger physiological issues, is there anything else or anything else you'd like to expand on?
Well, you know, I'd just like to make a couple of comments, really, is that because when we say oral, it really implies the entire mouth. And oftentimes, you know, people just assume that dentistry is about teeth and gums, and that's certainly a really important part of our oral health, but oral health also implies the connective tissues and the ligaments and the bone that we have in our mouths. It also implies the hard and the soft palate and all that soft mucosal lining of the mouth, the throat, and the tongue and the lips and the salivary glands. And moreover, we even have the chewing muscles, the upper and the lower jaws. Mm-hmm. These are all connected to the head by the temporomandibular joints. I mean, it's such a complex system. It isn't just teeth or the things I've talked about, but it's also the nervous system and the immune system and the vascularity, which help to operate and nourish all of our oral tissues and providing connections to the brain and to the rest of our body. I mean, the mouth sort of sits between the brain and the rest of the body, so it's a very significant component. And even as science has taught us, there's a very strong genetic relationship between the development in utero of the oral tissues in combination with the tissues of the face and the head and the developing brain. So it's all highly interconnected.
Do you think that as people sort of age, I think that children get a lot of general dental care? I mean, parents make sure of that. Do you see a sense that as people get older that becomes sort of less paid attention to?
That's a great question, Nick. I really believe that children do get good care, especially in our community. And oftentimes, parents, as they get older, have maybe neglected their own health as they've sacrificed for their own children, so to speak. But as they get older, they realize how important their health of their mouths really is. And so they come back, and they oftentimes in their 40s, 50s, 60s, and oftentimes into their 70s and 80s, we have patients coming back and saying, I just feel so debilitated by not being able to chew properly, or I don't like the way my smile is. And so they really are very, very interested and very passionate about trying to do what they can to help them not only chew better, but to feel better and to look better. So, yeah, I think there's a real increasing interest in our patients as they are getting more mature age-wise in their lives.
I know I've been through that myself. That's why I ask. I had to come back and fix my teeth, and, of course, I'm happy that I did that. Okay, well, we're running up against a break right here, so we're going to take a break, but then we'll be right back with Dr. Norm Ickert from the Ickert Dental Implant Center.
More Healthy Smiles with Dr. Norm Ickert from Ickert Dental Implant Center after this.
Take control of your financial future with sound investing with Byron Stryloff, Senior Investment Advisor and Chartered Financial Planner with over 30 years of experience on the Home Channel on localwebradio.fm. To schedule a face-to-face conversation, you can reach Byron at 604-535-3700. That's 604-535-3700 and online at www.byronstryloff.com.
Shopping for the lowest mortgage rate? Looking to refinance? Catch Jared Dreyer in the Mortgage Lab on localwebradio.fm. Buying or selling a home on the Semiahmoo Peninsula? Catch up on local market conditions on This Week in Real Estate with Lance and Connie Marples from Sutton West Coast Realty on localwebradio.fm. To schedule a face-to-face consultation, you can reach Lance and Connie at 604-538-8888. That's 604-538-8888. And visit them online at www.surrey-whiterockhomes.com.
It's time now for more Healthy Smiles with Dr. Norm Ickert.
All right, I am back with Dr. Norm Ickert, and we are discussing oral health. So going back to what we were talking about before the break, are you saying that good oral health is more than just teeth and gums?
Yeah, absolutely, Nick. And that's something that we oftentimes overlook because we really do tend to focus more on teeth and gums, especially now with the whole aesthetic revolution. And everybody wants to have white, bright teeth, which is nice, but it's not really what good oral health is really all about. I mean, good oral health is, in essence, being free of chronic facial pain conditions known as TMD. It means being free of any oral or pharyngeal/throat cancers or any other soft tissue lesions. It means being free of congenitally absent teeth. And there are dozens of other diseases and disorders that affect us in the mouth. And that's really what I mean by saying that we have good oral health, is if we are free from those other lesions. For example, many people don't realize that having little red or white spots in their mouths are not normal unless they come from some kind of frictional forces of cheek biting or other things. But anything that can't be wiped off or that lasts for 1 month or more than 1 month is not normal. And that should be examined because the prognosis for any type of serious lesion in the mouth is not great. And the only way that we can really make that better is by early diagnosis. And I think that's so critical that we take that seriously. And, most dental professionals are very well educated and equipped to help people, to assure them that they are healthy. And if they're not, we have the right people to refer them to help them with their issues. And, I want to say also that when you have oral tissues that are healthy, it really does represent, in some ways, the very essence of our humanity. Because what it allows us to do, it allows us to chew properly. It allows us to speak properly. Because every day I have people coming in saying, I really just want some back teeth because I just can't chew my food anymore and I'm just tired of just eating mush. I really want to eat a steak again, or I want to eat a salad again. And so the importance of just replacing one molar or maybe several molars is critical. Or people come in and say, I'm so tired of this denture. I can't stand how bulky it makes me feel. I can't speak properly and I'm losing my confidence. And to be able to throw that denture away and support it with something else is also life-changing. Mm-hmm. I've got people who come in every day and who put their hands in front of their mouth because they're embarrassed about how their teeth look, or they might have broken a tooth and they just don't like it. And to be able to assure them that they can have their smile back so they can feel confident and laugh again, it's huge. Yeah. And so our oral tissues, whether it's teeth, lips, or anything else, it's so important for us. It does everything from giving someone a kiss, to smelling, to tasting, to touching, to swallowing. I mean, all these things, we convey so many wonderful emotions with our facial expression. So oral health in general is just so important. And most importantly, it provides the protection against microbial infections and other environmental insults that we have. So it's like the skin that protects the rest of our body, because it's interesting that it's really the only part of our entire body where an object sticks through our skin, with the gum being the skin. And that has a direct communication to the rest of the body. So if your gums are inflamed and bacteria gets into that inflamed tissue, it runs into the bloodstream, which runs right past the heart. So it's very critical that our tissues are healthy, because there's been a very strong associationship now that we've noticed between several diseases and unhealthy gums or an unhealthy oral environment. And we've got strong associations between heart disease and vascular disease, and a very well-documented relationship between gum disease and diabetes. So the mouth is almost like a mirror. It provides just a wealth of information that when we examine it properly, we can actually get a look into the rest of the body. So you can see that it's easy to get passionate about the oral cavity, because it's just such a wonderful mirror of everything else that we deal with our overall health.
Yeah, I mean, that's a lot of good information. I was struck by, it's a good reminder that, what did you call it? Was it the aesthetic revolution?
Yes.
It's not just about looking good, but we're talking about actually feeling better physically and making a real difference in your overall health just by taking care of your teeth.
Absolutely. And I can tell you that even from personal experience, I mean, I was 34 years old when I finally decided to get orthodontic treatment done for myself, including some surgery to reposition the bones and reposition my teeth, and to give me a bite that I felt good about. And it actually was one of the best things I ever did for myself. Mm-hmm. It gave me such a sense of confidence and also just a feeling of well-being every day when you have a bite that feels right. So I've experienced that firsthand, the difference that it can make. And it's really an investment that I have never, ever regretted.
Now, are there any other important aspects of oral health that you think we should talk about?
I just like to say that, I mean, we all know about gum disease and we know about decay and we know about all those issues, but really, I just would like to say that if we focus on having good oral health, it actually gives us an amazing state of physical, mental, and social well-being. It provides confidence, self-esteem, and it just helps us to move into our day confidently with everyday function, because we feel so good about our mouths. And people have often said, what's some of the most important things that you look at when you see another person is oftentimes their eyes and their teeth and their mouth. And it's such a big part of how we communicate and how we interact with each other in society. And that's just one small part of it, but the whole other aspect